Lauren, doctors say gun violence is a public health emergency and should be treated like a crisis. Here in Wake County, EMS responded to about 192 shootings and stabbings last year, and they are on track to do the same this year. Tonight, I spent some time getting to know those people who are working to keep those victims alive. They share with me the emotional toll this job can have.
911, what's your emergency?
A 911 call goes out, and it's a shooting.
The clock starts.
These guys are among those who are responding. Paramedics with Wake County EMS, and time is of the essence.
We want to get off as fast as we can because the quicker we get someone to a trauma surgeon, the better chance they have of survival.
Will Holland and Avery Brown are district chiefs with Wake EMS. They have responded to their fair share of shootings and stabbings. There have been 64 so far this year.
We are looking for holes. We're trying to close the holes, stop the bleeding, secure their airways, manage their pain, get them to the hospital as fast as possible.
And it's inside this ambulance where those life-saving measures take place as they work to get the gunshot victims to the hospital.
All the essential equipment that you need in the emergency room, we bring to the streets, and then we get it from the streets to the doctors.
And those doctors are here at Wake Med, a full trauma team prepared to handle the gunshot victims as the only level 1 trauma center in the county.
As soon as the alert comes in from EMS that we have a victim with a gunshot wound, the team is triggered.
Dr. Osi Udeku is a surgeon and has been the head of trauma at Wake Med since 2002, where the hospital has gone from treating 1,200 patients a year with all kinds of traumatic injuries to 5,000. Many are children.
Now shootings outnumber stabbings significantly. In the last year, firearm injuries between the ages of 1 and 18 have actually tripled.
And it's the shootings that leave kids injured or dead that take an emotional toll on both the doctors and paramedics.
Seeing the dad carry the body out, his helplessness was just, I felt his burden, I felt the heavy weight of him carrying that.
So they find ways to cope. For paramedic Avery Brown, that means leaning on his fellow coworkers.
We have each other. What better to know the emotion than our coworkers or people that are in the streets with us dealing with those same calls.
They also have a psychologist available 24 hours a day. They also have a peer support team that can help those paramedics. Over at Wake Med, they recently launched a trauma survivor network helping those patients once they leave the hospital. In Raleigh, Janice Price, ABC 11 Eyewitness News.
Yeah, your story really paints the picture that crime affects all of us in some way, big or small. Janice Price, thank you.